Okay. Madoda, Sambatha, MEC Health, you are watching Tsamapilo TV. Today we're opening a field hospital, 200 bed. Field hospitals are meant to help government mediate between availability of beds in the normal hospitals and the increase of patients during the time where you have a surge. So for 200 beds already, we need the extra 300, which means each province like ours must have 500 bed capacity for field hospital. COVID-19 still it's a problem. People must take decisions. Ensure that it is not transmitted through your movement. Ensure that you will ensure that others are safer when you know your conditions, and ensure that you are not going to move up and down. You sanitize, you wash your hands, keep social distance. Whenever there are symptoms, consult a public health or private health facility.
The action is simply excitement and quite impressed. If one considers that about 2 weeks ago we were here when the Deputy President visited us, it was not in this condition yet. And within that short space of time we come here, the facility is officially open. This is how we should approach combating of this virus. We don't make decisions and perseverate forever and not implement. The new normal requires action. When we make decisions, we must implement those decisions. And I think once more, this facility has proven that it can be done as it has been done. So we're delighted. Remember that we're in the epicenter of the pandemic, and our strategy clearly has to be where you find the flames, small flames, kick them and douse them, because if you allow these small flames to all come together and you get a big flame, you will have it difficult to put it out. So that we can only say well done led by the CEO of the Bafokeng Platinum Mine. Well done, and we're quite impressed by the excellent work that is being done in this part of the province. And Mr. Piri and his team are doing extremely well. And let's continue to operate that way, where we roll up our sleeves and tackle this pandemic, where we roll up our sleeves as we manage, as we push back in this new normal. We're excited as government.
And how would you then say the collaboration between private sector and government, how significant is that given this facility?
Well, this is something that we should really have long thought about, not only think about, but implement. The challenges, even before the outbreak of the pandemic, the challenges arising from the triple problems of poverty, inequality, and unemployment are such that no one institution can tackle this. The task is too momentous to be tackled by one institution, and this kind of approach is the way we should go. Addressing problems of service delivery generally, collaboration and partnership is the way to go. Addressing matters of emerging contractors, emerging enterprises, instead of talking about reversing the ravages of apartheid. we should actually actively do something about that. For instance, where we pair up established engineers and contractors with emerging contractors, and so that they go up the ranks. Again, it's an example of where the public sector would open space for young people to grow by working with in collaboration with the private sector. That's the way to go.
Ka tsona fela Premier lo tsibogela yang le dipuso tikwatikwe ele
no really puso tota re motlotlo re itumetse thata hela ka kgatelo pele re bonang mo karolong eno mo sedikeng se sa bojanala re itumetse thata la re bona tlhabologo tswelelo pele e diregang fano re wa bona go patagana ga puso le private sector go botlhokwa thata taela ka gonne bona ditiro tse re kgonang go di dira re le puso ga re patagane le private sector le ba kgwebo potlana kgwebo tse di tona go botlhokwa thata le re dire jalo jaanong ke re dikai tse di boneng gompieno ke selo se re tshwanetse re se rotloetse gore ga ntse re tsweletse ka ditirelo tsa rona mo setšhabeng ga re ntse re tsweletse ka go sešwa le tlhabololo go tla re thusa thata gore re patagane re le puso le ba dikgwebo.
Steve Phiri, CEO of Royal Bafokeng Platinum.
Dr. Phiri, are you this facility? Can you take us to this facility? How did it happen that you donate this to the program?
Well, with full understanding of the requirements in order to contain or at least to slow down the spread of COVID-19. We did understand that at one point you're going to need hospitalization of people who are tested positive and who might need even treatment. Better early than be sorry. And we started with our preparations. We knocked our heads together. We did not know where to start. Somebody cleverer than me said there is a change house at Maseve which we are not using. We can convert it. Then we said, okay, that's Philip Kutzer, the one guy who's been taking you around. And we sent a team of engineers led by Philip Kutzer. He's an engineer. To look at this, started doing the designs, the plans, and boom, that's where it is. We didn't know it will cost this much, but it didn't matter much. What mattered was the lives of people. We tried to contain the cost, but this what we spent here, I think it will be worth every cent.
Tell us about this facility, the capacity.
It's a capacity of 200 beds, fully finished with all the heaters, infrared heaters, with UV systems for air control, bacteria killing as well as virus killings. It's a real modern facility. Every bed has a television set with 15 channels, so everyone can watch his own channel at the same time, with a full Wi-Fi, free Wi-Fi facility. Just to mention the few, with full laundry system with hot and cold water, with the disposal tank for medical waste, and on and on and on. It has got a female section as well as a male section, fully demarcated. No one will go to the other section. Yeah, I think the guys have outdone themselves.
The last question is in terms of the staff complement that are going to manage this.
Yeah, that's an important one because that talks to collaboration with the Department of Health in Northwest as well as Bojanala Health Department. Collaboration with government public-private partnership does not, it is not only dependent on monetary contribution in kind, whatever the case might be. It is a mindset, it's the understanding and an appreciation that it is the right thing to collaborate and join in partnerships. And therefore, once the company contributed the asset, the physical asset, the refurbishing of it as it stands today, government with its support and ideas came in, especially their expertise in health came in, and therefore that is where the partnership comes in. So we handed it over today. The government will be running, the Department of Health will be running this facility for all of us, not only for themselves, not only for us, but for all of us. This facility is not only going to cater for the employees of Royal Bafokeng Platinum, but also members of the community who test positive. Yeah, tirisano mmogo ya rona le lefapha la pholo mo Northwest province ga ya ikaga fela mo goreng mang o ntshitse bokae go tswana le go kerekeng ba bangwe ba phampadisanya gore ke bolekile go go feta ga re dire yalo mona. Lefapha la pholo le tla ka kitso ya bona ya pholo, ba tla ka dinese le dingaka tsa bona, ba tlo tsamaisa setheo se ba re thusa ka kitso ya bona. Rona we are minus re baepi ba platinum re ka aga so se tshwana le sena, but ga re itse ra mothalo ala re direng kae. But Department of Health e na le kitso eo, ke ka moo ba tsenang ka teng. Setheo sena ga sa agelwa fela badiri ba Royal Bafokeng Platinum, sa agetswe mo le mongwe members of the community, baagi ba mo tikologong mona le mo Northwest. Mo go na le tlhaelo wa malao teng, re na le malao le teng fana, ba ka tsaya motho a tswa kwa tswang teng ba tlo mo tsenya fa ga re kgetholle ope. Thank you. Thanks.